Hi, this is Dr. Petnato again from Cool Kid Dental. I just wanted to go ahead and give you a little instructional video today on how to do the aftercare for a lingual frenectomy. As I mentioned in the previous video, lingual frenectomy is when they have the tongue tied basically. When the tip of the tongue attaches so that the child does not have full range of motion, they often can't put their front tooth beyond the lower front teeth, and it limits their motion for lots of different things, especially with speech and articulation. But we'll go ahead, and the other video covered that, so I will not go over that again here. Today's just how to care for it afterwards. As you can see on the picture here, here's roughly what a wound will look like after a frenectomy is done. Have a little kind of triangular shaped wound there under the tongue that our laser uses and cauterizes the tissue, so there'll be minimal to no bleeding, and discomfort afterwards is very minimal. So here's a little model to show you. So basically I have a triangular shaped little wound down there. When you go ahead and do the little stretches, you want to do these stretches 3 times a day for 2 weeks, and then you're going to come back to our office for an evaluation. The big thing is, some people think that, oh gosh, if I just push on the top of the tongue, push it back, it's going to do it'll stretch it. No, it's not. The tongue is not solid, there's no bone inside of it, it's just going to bend like that, so we'll be pushing the tongue back, but you won't be getting the movement down here. We want to have full range of motion to give it good stretches so the tissues do not reattach and limit the motion. We want full range of motion for your tongue. So what you do is go into the child's mouth with your fingers, take your thumbs, kind of slide them along the bottom, pull apart. So you're kind of pulling a little bit apart to keep the tissues so they're detaching in a side-to-side motion. Then you can take your fingers and push the tongue backwards. Again, you're not just pushing on the tip of the tongue so the tongue bends. You're actually getting your fingers at the base of the tongue and stretching it backwards, kind of pushing the tongue back into the back of the mouth. And so it gives it a good stretch there. This does not take very long. It should take you maybe, say, about 5 seconds, maybe 10 seconds to do. So again, go down, stretch out, push it back there, and that will do that. What you want to do is do that 3 times a day for the 2 weeks, and then you'll come back into our office for an evaluation to see how things are healing. Of course, if you have any questions or need any other help, you can visit us at our office in Northport, Florida, or you can go ahead and check out our website on coolkiddental.com. Thank you.